Hey everyone, it's Dr. Chris Shaver, host of the GI Show, and we are here with you for the GI Show, episode number 4, and we're talking about irritable bowel syndrome, which is a really important topic that you need to know about. In fact, I've titled this Understanding Irritable Bowel Syndrome for the first time because, number one, I kind of want to demystify it for you guys and just sort of help you understand it on a kind of a core level. And also, I don't want to really assume what you do know about it. And so I want to dispel any myths or misunderstandings that may be taking you down the wrong path in understanding and dealing with maybe your diagnosis of irritable bowel syndrome. So anyway, welcome. We are filming here at the lovely BGA Studios. And a bit in the shadow of COVID-19, which has been this pandemic that has hit this country significantly. But it is April, beautiful weather, a lot to be thankful for this Easter week and Passover week. And it is IBS Awareness Month. So I thought it was a perfect time to really delve into irritable bowel syndrome with you. Remember, our mission here is to educate and inform you, the GI patient, on your journey, on your health journey, and to just educate you so that you understand and can be proactive in your GI health. Very excited to present to you my special guest, Dr. David Landy. Dr. Landy, would you join us, please?
Sure. Thank you very much.
Good to see you. We can't shake hands, man. It's
right.
Social distancing.
That's
We're
right.
a little too close, but it's just the two of us, and we're both afebrile. So we're good there. So anyway, I do appreciate you joining us today. It's a real pleasure to have you. I've known Dr. Landy for many, many years, probably 15 or 20 years. We've been partners in private GI practice, and we've been friends. We know each other's families. So it's really good to hear his perspective on a really important topic that we're talking about, irritable bowel syndrome. It is, as I mentioned before, April is IBS, Irritable Bowel Syndrome Awareness Month. And so I'm looking forward to getting your perspective. I know that we see a ton of this in our practice, don't we? In fact,
Absolutely.
you know, it's estimated that about 30% of a typical private GI practice manages irritable bowel syndrome. So super important to talk about, understand, because it can be challenging. The good news is, I'm just going to start with some good news, is that just generally speaking, IBS has a really good prognosis. So fortunately, IBS patients live a normal lifespan. However, the other side of IBS is that it can cause significant symptoms, significant reductions in quality of life, and a lot of anxiety and concern on the part of patients. So tell me about IBS in your practice, just some general thoughts sort of about kind of IBS in general.
Okay. Well, I mean, I'll give you just a GI, private practice GI perspective of it, because it is something that we all deal with. In GI, it's one of the most common reasons for consultation. I think we see as kind of the tip of the iceberg with IBS. You know, I think we see just people that are fairly symptomatic with it, and most of the people that we see, you know, they're a little nervous. You know, they've got some symptoms or a little bit kind of on the higher end side of symptoms. And they're worried. I would say that most of them are worried that maybe there's something else going on. It's not just IBS. Like you mentioned, IBS, although it is a very common reason to miss work and school and things like that, but it's not going to kill you. The increased mortality is not there. It's not something that would, kill you. And I think a lot of the things that we see are people that, they're having the symptoms, whether it's the diarrhea or the constipation or the alternating between the two, and the abdominal pain. I mean, those are the common things. And
let me ask you this.
Sure.
And that reminds me, I have a brief little story to tell about IBS, how it's affected my life, kind of in a positive way. That sounds crazy, but I'll get into that in a minute.
Okay.
Tell me, so one of the things I found is that, and one of the frustrating things for my patients, and I think for these patients in general, is, so this is happening to me, these symptoms that bother me most days, impact my life, affect what I can do, affect, like you mentioned, work, and no one can tell me what the heck is going on. Like, what is happening to my body, doctor? Like, so talk to me a little bit about causes. Now, I'm going to preface that by, I'm going to sort of restate what I know you know, the obvious, that we don't know. That the reason it's not irritable bowel disease is because we don't really know the root cause. Talk to me about causes. Sort of, what are some of the prevailing thoughts about IBS cause?
Okay, now that's a good question, because honestly, I don't really think I know the absolute answer.
I don't either.
I don't think anybody does, really. But I think it's a combination of a lot of things. I mean, I think it's a combination of anxiety, central nervous system aspects of things, motility. I always think of it as people that have this are just more sensitive to their GI tract, like they're feeling the GI tract move around and do things.
Visceral hypersensitivity.
Right. Visceral, that's a...
Yeah, hypersensitivity, visceral hypersensitivity.
I think that's about maybe as far as I could go as far as causes. I don't think it's a specific organism. There are some theories that, maybe it has something to do with the biome and the bacteria maybe creeping up into the small bowel and doing things like that.
Right.
But I don't know that you can get much more specific, but I could anyways.
Right. I heard you mention anxiety, stress. We know that there's a relationship between the brain and the gut, particularly with IBS. But what I tell people is that your brain doesn't cause IBS and your anxiety doesn't cause it, but there is a relationship.
Right.
Talk to me a little bit about that relationship, the brain and the gut. They interact, right?
They definitely interact, and I think I don't think you can get I don't know that you can get a consensus on this amongst all of us as physicians and experts, but I think there's definitely a relationship, and I'm sort of the camp that your anxiety may not cause a disease, but I think that if you had really almost any GI disease, even if it's inflammatory bowel disease, which is something like Crohn's or ulcerative colitis, and you're having a lot of anxiety, I think it causes more symptoms. And same thing with IBS. And I think everybody will have IBS symptoms from time to time, but if you're having more anxiety issues, it unmasks it. That's the way I think about it.
Yeah, I do think it's a source of flaring of the disease, and going into some of the studies that sort of show relationships is kind of beyond what we need to convey to you today. But I think that's exactly right. That it can affect the gut in powerful ways. And I wanted to make one more point about that, is that we have to be clear as physicians managing IBS patients that we don't convey the concept that it's all in your head.
Right.
And that's something I think that having done this long enough, that doesn't go over well, because it's not accurate, number one, and number two, it tends to be dismissive, and we don't want to be dismissive of IBS in any way because it is so impactful and has such a negative impact on quality of life. We're here to really try to improve quality of lives and not dismiss or move past important symptoms. So that's just what I wanted to say.
Yeah, and I wanted to just comment on that. And we're not going to. I know we're going to talk about treatment later,
Yeah, right.
but I think a lot of this is, like I said, when people are coming to see us, I think they're kind of scared.
Mm-hmm.
A little anxiety just because they're having these symptoms, and some of it is reassurance. We say, well,
Right.
it's IBS. It's not It's not in your head, but that's what it is, and we'll talk about treatment, but it's the symptomatic treatment, and it's not going to affect your overall mortality. And I think a lot of that is actually part of the treatment of it as well.
I think that's an excellent point, and I totally agree. Well, thank you guys as always, and we wish you good health as you navigate these sort of tough waters in this COVID-19 pandemic. So be safe, be careful out there, and from the shadow of Vulcan, right back this way, stay regular.